Hey guys, I'm Combat Craig, and today I'm bringing you a story about a VA pharmacist that got popped for stealing prescription narcotics from the US mail. What a shocker. Corruption, theft, this stuff goes on and on. I wish our Office of Inspector General was about 10 times better so they could get more of these guys. But I mean, I guess they're getting them. And the pharmacy is usually a place that I don't talk about. I've talked about other investigations, and I will say that this guy isn't. He hasn't been. He's been charged, but he hasn't gone to court yet, so he's presumed innocent. But I just want to kind of talk about the role of the VA pharmacist and things people could have done to possibly avoid this, or definitely avoid this. So before I get started, if you want to learn more about the VA claims process and specifically my process, you could go to combatcraig.com and sign up for my boot camp. I explain what I did to get to 100% PNT, and I'm sure there's something in my courses that can help you out. So I made it for you guys, so take advantage of it. All right, so the VA pharmacist. I've only been assigned one VA pharmacist. It was about 2 years ago, and I'm pretty sure the pharmacist was in there was because I was being prescribed opioids. Not 100% sure. So if that's, indeed what was happening, that's what makes this story even more ridiculous. So you have a VA pharmacist involved in the opioid stuff, making sure this doctor, that doctor, this shrink, the drugs aren't overlapping and all that kind of stuff. And then you got the pharmacist stealing stuff out of the mail. So in my case, I think my pharmacist was out of Billings, Montana, VA, and she would call me once a month and check with the drugs and don't mix this with that. You really should get off that, that kind of stuff. Authority figure. So that's the role of a VA pharmacist. And if you have never heard of a VA pharmacist, I mean, I know you've heard of them because we're assigned to them, or that's where the meds come from when they ship them to you in the mail. But you might not have ever had one-on-one with a VA pharmacist. But like I said, I think it was because of painkillers. So leave me a comment and let me know if you are dealing with a VA pharmacist every month because of painkillers or whatever else. Okay, so this VA pharmacist is out of Kerrville VA Medical Center, and this is out of San Antonio. So this is in Texas. The Texas Office of Inspector General is, I've done another story about them a couple months ago, so they're doing something. They charged a pharmacy technician at the VA Medical Center in Kerrville with stealing hydrocodone and oxycodone prescriptions from the VAMC mailroom and from mailboxes at some 40 locations in Kerrville, Ingram, and Center Point. So I'm going to stop right here. So this is a pharmacist stealing prescriptions from the mailroom. Like, I don't know exactly what the facts are, but, would this guy fill a Norco prescription and then put it in the outgoing mail pile and then steal it right out of there? It had to be something. Obviously, obvious like that. When I'm talking to veterans and I'm talking about corruption that's rampant in the VA, in your VA regional office, whether you like your doctor or doctors or not, there's sketchy shit going on at your VA right now. Every single one of them. If you're a VA employee, speak up and say something if you want to do something and be helpful. Don't just collect your paycheck and turn your back. Like, here's the doctor, right? Writing a prescription for Norco. Like, yep, we lost that one. Oh, well, where'd we lose it? You're talking to the pharmacist. Oh, well, yeah, the tracking says that it never even got shipped anywhere. Didn't even make it to the first point of delivery, when they pick it up from the VA and then whatever, ship it to Salt Lake City or whatever, right? Your local big city. And then that happens 20 times. Like, obviously somebody could have said something, especially the stuff that was getting stolen out of mailrooms. Now, I don't know how big of a problem it is because with the VA, it's a little bit different. They ship you your Schedule 1 drugs. And in the civilian world, which obviously we're all civilians, you have to, get prescriptions from for Norcos and Vicodin and stuff, and you actually, it has to be on a piece of paper. They can't call it in anymore. And then you go hand it to the pharmacist, and they hand it to you, and you sign for it. So the VA is a little different because they use U.S. mail to ship it to you. So I wonder how many of these shipments are going missing on a monthly basis. I would imagine it's probably not that much. And then all of a sudden, like they're getting lost out of the mail room, and they're, showing up in PO boxes that who knows what the deal is. They don't exist or something like that. So who's on track of all this stuff? Apparently, it's the VA Office of Inspector General. So, a federal criminal complaint charges 35-year-old Kerrville resident Scott M. Brown with one count of theft of U.S. mail. According to the complaint, the Kerr County's Sheriff's Office received several theft reports from victims beginning in March 2021. So they actually got on this guy pretty quick. As I sit here now, we're at the end of May. Victims reported that their prescriptions sent from the VAMC were missing, according to the complaint. Brown allegedly stole packaged narcotics from inside the VAMC mailroom, as well as residential mailboxes. So this is even better. So he would either steal it before he ships it, or he would ship it and then show up and snatch it out of their mailbox before they were able to get it. I wonder why they didn't have, maybe he forged their name or something. He obviously didn't get charged for it. So this one's kind of fishy. I'm sure once they get his ass in court, I'm sure the charges are going to rack up more as they learn more about it. DEA was involved, the U.S. Postal Inspector, VA Office of Inspector General. We're all involved. And upon conviction, Brown faces up to 5 years in federal prison. He remains in custody awaiting a detention hearing and before a U.S. magistrate judge. The DEA, USPIS, VA, OIG, and the Kerr County Sheriff's Office are still investigating this case, and Assistant U.S. Attorney Priscilla Garcia is prosecuting this case. So a criminal complaint, again, is merely a charge, and it's not considered evidence of guilt. So, he's presumed innocent at this point, even though obviously he's not innocent. He's a dumb shit. So I'll put a link to this article. Check this out. And I want to bring, good things the VA does, bad things, VA claim stuff, all of that. That's what I like talking about here on this channel. And if you enjoy this kind of content, please hit the like button and consider subscribing so you don't miss any more of my upcoming videos. Combat Craig out.